Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about 𝐺𝐽 tube. The gastrostomy jejunostomy tube, which is abbreviated as 𝐺𝐽 tube, it is a feeding tube and it is inserted by creating an opening in the abdomen which is called stoma. It has three ports. The gastric port or G port opens in the stomach. The jejunal port opens into the jejunum, which is the second portion of the small intestine, and the balloon port has a balloon which is water filled and it holds the tube in place. The disc around the tube outside the body, it prevents the tube from sliding in and out. This 𝐺𝐽 tube is placed either by an interventional radiologist who uses X-ray to guide the tube in position, or by a gastroenterologist. Now, what is the indication? The indication of 𝐺𝐽 tube is when oral route cannot be accessed for nutrition for a long period of time and the patient cannot tolerate nutrition in the stomach. Example, poor motility, or if patient is having severe reflux. Now the G port is used to drain either gas or fluid, so thereby you're decreasing the risk of aspiration and vomiting. Now the G port is also used to give medicine to the patient. Now the J port, the jejunal port, is used to feed the patient and it's used for a continuous feed. Remember, jejunum is small intestine, so you cannot give large amount of feed at a time. If you give bolus feed, the small intestine won't be able to handle that and patient can have dumping syndrome and diarrhea. There are two types of 𝐺𝐽 tube, just like PEG tube or a G tube. One is low profile tube. This is low profile tube. It is also called button tube or a long tube. If a patient has a button tube, you need an extension tubing to give feed to the patient. Now let's see how to connect the extension tube to the button tube. You have to hold the button tube and insert the extension tube so that you line up the black marks. Then you rotate the extension tube until it locks, until you hear a click. You have to rotate almost 3/4 of a circle. You insert it and rotate 3/4. 1, 2, 3. So in this position, you lock the extension tube and you can give feed through the extension tube. Now to unlock, again rotate in the opposite direction. Make sure you line up both the marks, hold the button tube, and you can remove the extension tube. Now let's see the care of the patient. You have to assess the skin around the stoma for redness, tenderness, irritation or drainage. This can be signs and symptoms of infection. Or for a granulation tissue. This is excess growth around the stoma. If present, inform the primary team members. Now you can leave the site open to air. If gauze dressing is present, change the gauze dressing daily. You should wash the peristomal skin with warm water and gentle soap, or you can use a Q-tip to clean the peristomal skin and let it air dry. Before and after giving medicine, you have to flush the 𝐺𝐽 tube at least with 30 to 60 ml of water in adults, because you don't want to clog this tube. Make sure you crush the medicine properly, mix it with enough water, and it should be flowing easily through the syringe. If it flows easily through the syringe, it will not clog the tube. You have to flush the 𝐺𝐽 tube with water for both continuous or intermittent feeding. If the patient is getting continuous feeding, see the orders, or you can flush every 4 to 6 hours for continuous feed. For intermittent feeding, flush before and after the feeding. If you are using button tube, you have to wash the extension tube after feeding with warm soapy water, then rinse it and let it air dry. This extension tubing is reusable. By any chance, if the 𝐺𝐽 tube gets misplaced or pulled out, remember you cannot replace at the bedside. So hold the feeding and inform the care team. So today we learned about 𝐺𝐽 tube, and thanks for watching my video.